Well, it's Tuesday, and as you know, we're joined by our In Focus health correspondent, Lino Madu, with some more health news.
Yes, indeed. Today we will be looking at epilepsy. But first, Israeli officials have confirmed the country's first death from the H1N1 swine flu influenza virus. The World Health Organization says thousands more could die unless an effective vaccine is developed soon. Voice of America's Melinda Smith has details.
This year's pandemic spread around the globe with record-breaking speed. It has taken less than 2 months for the H1N1 swine flu to spread, while previous pandemics took 6 months or longer. Yet Dr. Keiji Fukuda of the World Health Organization warns this global outbreak is still in the early stages.
We have a very large global population, and it is quite clear that we'll continue to see spread of this virus through countries and then among countries.
Most of the patients have been teenagers between 12 and 17 years old, but the virus is spreading more deeply into many communities. And the WHO says the average age of patients now appears to be getting slightly older. While young people and pregnant women are still at higher risk for contracting the H1N1 virus, health officials also caution that patients with cardiovascular disease, respiratory illness, diabetes, cancer, and obesity are just as vulnerable. Some clinical trials of potential vaccines are underway. Others will start soon. The European Medicines Agency says large-scale clinical trials will be bypassed in order to get vaccines into the general population as soon as possible. Health officials in Britain, Greece, France, and Sweden have announced they will begin inoculations among the public, possibly within weeks. The WHO's Dr. Fukuda has not criticized that decision, but expressed concern about rushing vaccine production too soon.
There are certain things which cannot be compromised, and one of the things which cannot be compromised is the safety of vaccines.
Meanwhile, the World Health Organization says countries with widespread infections have switched from reporting individual testing of all patients to monitoring and reporting trends in the population. According to the WHO, testing of patients has strained the laboratory capacity of many countries. Dr. Fukuda believes health officials can still accurately predict the pandemic's size.
We know that the total number of laboratory confirmed cases is really only a subset of the total number of cases.
Recently, the International Health Organization said it would no longer publish global tables reporting the number of new cases for all countries. Melinda Smith, VOA News.
We turn now to epilepsy, and scientists at the University of Liverpool suggest that children aged 3 years and younger who are born to women who took the anti-epileptic drug sodium valproate while pregnant are likely to have an IQ of 6 to 9 points lower than average. The preliminary findings also suggest that children exposed to the drug had lower IQ results than children exposed to other anti-epilepsy drugs, regardless of the mother's IQ. The researchers also say sodium valproate is used globally and does have a favorable safety profile for adult patients. Now we have more on epilepsy, Demi, and it's a condition that really a lot of people still are a little bit confused about.
Why?
Well, first of all, let's try to understand what is epilepsy.
Okay.
It is a neurological condition that affects the nervous system, and epilepsy is also known as a seizure disorder. A seizure is a sudden surge of electrical activity in the brain that usually affects how a person feels or acts for a short time.
What are the causes of epilepsy?
Well, the causes are unknown, experts say. They say that the seizures in epilepsy may be related to a brain injury or consistent with a family tendency, but most of the time the cause is unknown, as I said earlier.
Now, if somebody's having a seizure, and I don't know if most people would know if they're having a seizure, what are the symptoms to look out for? What would tell you that I'm having a seizure, for instance?
Well, the symptoms can be diverse, but here we are going to tell you some of the symptoms that you may see. You will see, for example, convulsion, difficulty talking, drooling, so the person will be drooling. Also, the person will fall down, so you will see them, you know, falling down. The eyes will be rolling, and they will have some twitching movements and some stiffening of the body.
And I understand that there are different types of epilepsy seizures, not just one common kind.
Absolutely, Demi. Experts say that there are many different types of epileptic seizures. They divide them into several categories, including generalized seizures and partial seizures. Kevin suffers from epilepsy and describes what his seizures are like.
As I start losing my speech, as well as my sight, I just, everything just, I can see you, but then again, I don't see you. And I'm just staring there like I'm listening to you, but then again, I don't hear you. And then my right hand will curl up at an angle, and then I'll start shivering sometimes, and sometimes I won't. Sometimes I'll just be standing still. And then sometimes I'll start mumbling out of the mouth, saying crazy things that don't make any sense at all.
Well, that's really interesting,
yes,
Lenore.
indeed.
So when somebody's having a seizure, I guess you call emergency 911, or is there a way to just attend to the person?
Absolutely. Experts recommend that, of course, if you are near a phone, you call 911. That's the first thing you want to do. But you try to keep the person away from any kind of obstacle that the person can hit when they fall down, because a lot of time people will tend to fall down. And also make sure the person lie on the floor and is away from any sharp objects and things of that nature. That can be the first step that you will take until you get help from you know, the emergency department.
Well, that's our Lenore Madu, always with up-to-date, very important information on health. And she joins us every Tuesday and Thursdays right here on In Focus with the latest health news.
And for more information on these stories, go to voanews.com.